Hello, and welcome to today's webinar, Integrating Grief and Loss Conversations into the SBIRT Model. I'm Tracy McPherson, and I will be your moderator for today's event. This webinar is produced in partnership with the ATTC Network Coordinating Office, AMERSA, and the Adolescent SBIRT Project by NORC at the University of Chicago. This webinar is part of the Transitional Age Youth webinar series. I encourage you to sign up for all of the titles that you see. As you'll note, you'll see some very interesting presentations on substance use and the developing adolescent brain, on the epidemiology of adolescent substance use, and substance use interventions for adolescents and transitional age youth. You can access everything for this webinar at the website on your screen, both now and in the future. That URL is sbirt.webs.com/grief-and-loss. Our team will also send you a follow-up email later today that includes the links to the PowerPoint, the on-demand recording, and a brief survey, and instructions to claim your free CE certificate. The webinar is approved for 1.5 CEs through NADAC. You can access the PowerPoint slides through the Handouts pane of your GoToWebinar control panel on your computer or on your mobile device, or you can download them from the website. You can ask questions at any point in this presentation through the chat pane of your GoToWebinar control panel on your computer or your mobile device, and answers will be posted to the website. Now it's my pleasure to introduce our presenter, Lisa Connors, who is the Associate Pastor of In His Image International Ministry Incorporated. She's a licensed Bachelor Social Worker, a licensed clinical professional counselor, a national certified counselor, a board certified coach, a master addiction counselor, and a certified clinical trauma professional. Ms. Connors is a certified grief counseling specialist, and she is also certified in thanatology, the study of death, dying, and bereavement. She's been in the human services, social work, and counseling fields for 30 years. And she's worked in a variety of settings providing services to the despondent and the downtrodden. Ms. Connors works tirelessly to help others reach their fullest potential in life, helping and empowering others who have been oppressed, stigmatized, marginalized, and victimized. Her greatest passion is working with individuals affected by HIV/AIDS, substance use and mental health disorders, violence, abuse, and trauma, grief and loss, and social injustices. Ms. Connors earned her Bachelor of Social Work, Master of Divinity, Master of Arts, and Professional Counseling degrees, respectively, and is completing her PhD in psychology. So it's my pleasure, Lisa, to welcome you, and I'm going to turn it over to you to get us started.
Thank you, Tracy. It's so wonderful to be here. So I certainly want to get started with the reading, and so we will do that. But first of all, I just wanted you to look at what the learning objectives are. You have time to do that on your own. So we're going to get started with the reading by Dr. Wofelt. And it's a book called Grief, One Day at a Time, 365 Meditations to Help You Heal After Loss. So Dr. Wofelt has a person to give a little quote, and then he goes into what he wants to share for a particular day. And so today it just talks about deposits of unfinished grief reside in more American hearts than I ever imagined. Until these pockets are open and their contents aired openly, they block unimagined amounts of human growth and potential. They can give rise to bizarre and unexplained behavior, which causes untold internal stress. Whenever we lose something or someone important to us, we grieve inside. But sometimes we do not express our grief. Instead of mourning, we carry our grief inside us. We try to wall it in and hope it will heal on its own. The trouble is, Grief unexpressed does not heal on its own. Time alone does not heal all wounds. And as we accumulate more loss and unmourned grief, we often find ourselves having trouble with anxiety, depression, relationships, substance abuse, and other issues. Uncovering and expressing all our unmourned grief leads to profound healing and wellness. If I am struggling, I will look to my past for unmourned grief. I will find a compassionate counselor to help me explore, express, and finally heal. And that is our opening reading for today, again by Dr. Wofeld. So I want you to ask yourself, as you're sitting listening to this webinar, I want you to ask yourself some of these questions. What stands in an adolescent's way of grieving? What makes it so hard for them? Why does it seem to be so unnatural for them to grieve their losses? What contributes to them putting their emotions on hold? Who says they have to be strong? And when can they begin to release their vulnerabilities? And I want you just to reflect on these questions, and I want you to think about them because they're very important as you're working with adolescents and as you start to work or are working with young adults. So I just want you to reflect on those. So I want to do just a brief IQ quiz, true or false. And I know you're listening to this, and so I want you to just kind of maybe jot down your answers, and we will talk about these. And so, true or false? Anger is not a normal response to loss. That is false because anger is a normal response to loss. Many people think that persons should be crying, they should be sitting in sadness, but anger is a normal response to loss. Also, true or false, crying can help with resolving grief. That is true, certainly. Crying can certainly help with resolving grief, along with some other things that can help, and we'll talk about that later. True or false, each adolescent and young adult grieve differently. That is true. Each adolescent and young adult grieve differently. No matter what the loss is, no matter what is going on in that person's life, every person grieves differently. True or false, all losses are the same. That's false. All losses are the same. And we'll talk about death loss and we'll talk about non-death loss. All losses are not the same. So then what is grief? So when we think about grief, grief, as I put it, is at the core of one's soul. It's that intense sorrow, it's the distress as a result of losing something or someone. And so it does cause emotional distress. It causes a lot of sorrow, and it just causes suffering as a result of a loss. So whatever that loss may be, whether it's a death loss or a non-loss, it does hit at the core of one's soul. So as you can see, the definition here is deep, it's intense, it can be very stressful, it can be very frustrating, it can be all of those things, but it hits at the core of one's souls as a result of a loss. So then we look at a variety of reactions to grief or reactions to loss as it pertains to one's grief. So you can see here that grief is a continuing process with many changes. So think about the seasons that we go through. We go through summer, winter, spring, and fall. And so when we think about the changes of the seasons, grief is certainly the same way. It's a continuing process with many changes. And when you think about it, people might say, well, today I feel sad, but tomorrow I was angry. The next day, I was disappointed. I was frustrated. And it's not just a variety of changes day by day, but a person can go through many changes within a day. So they may wake up and feel okay, may feel relieved, and then the next hour they may be sad, the next hour they may be angry or disappointed, the next hour they may be confused. So it is a continuing process with many changes. Grief is a normal and natural reaction to a loss. And so I don't want to make it so graphic, but I tell people all the time, when people are grieving, it's normal and natural. It's normal and natural, just like going to the bathroom. Also, grief is individualized and unique to the person that's experiencing it. It's definitely individualized and it is unique to the person who's going through it. Sometimes we want to do cookie cutter approaches and cookie cutter interventions, but just know that a person is an individual person and is unique to the person who is experiencing it and also going through it. Grief is a reaction to the experience of many kinds of losses. It's not just death alone. As I said, there are non-death losses. And in my work and the work that I've done with my clients, I find that a lot of people tend to go through more non-death losses than they sometimes go through death losses. So you can see here that grief is a reaction to the various losses or the various things that a person may be experiencing. So the nature of grief, as I said before, everybody grieves very differently. You think about support systems. Sometimes they may vary because people may not have the necessary support systems in place. The people they thought would be there for them, a friend or parent, may not necessarily be there for them. And ones they thought would never be there for them, maybe a coach, are the ones who are going to be there to support them. Resources are not always known or available. There are many resources in our communities, and a lot of people may not necessarily know what they are. And so I used to work for a hospice organization, and a lot of people did not know that we offer grief counseling. And so sometimes resources are there, but people may not know about them, or they may not be available, or they may not be available due to office hours or people getting off from work very early, and people needing counseling, but they get off at 6 o'clock, but the office may close at 4. So those are the things that we want to think about and consider, because we definitely want to make it accessible to persons who need it. Everyone has different coping styles. We all have different coping styles. When you think about adolescents and young adults, they're going to come to you and they're going to have different ways of coping. Some people cope by drinking and doing drugs. Some people cope by engaging in high-risk sexual behaviors. Some people shop, overeat. So everyone has different coping styles, but what we want to do is help people get to ways of coping healthy. And so that's what we want to help them do. There are also gender differences related to grief. When I was working in hospice, most of my clients were women, were female, no pun intended, but 99 point, I want to say 8% were female, and the other 0.2% were males. And so there are gender differences related to grief. And that goes by this standard with society that if you are quote unquote a male, you should be strong, you shouldn't be grieving, you shouldn't show your emotions. And so that's why there are gender differences related to grief. Also, there are culture and religious differences depending on one's culture. They may have grown up in a society or grown up in a household that says you shouldn't cry, you got to be strong. And then religious differences may be based on the fact of what one was taught based on their religion. Well, it's a loss, but you'll be okay. Just pray about it, meditate about it, it'll be all right. And so we can see here that it's a lot of different things that may be going on as a person is going through their grief journey. Individuals may also be experiencing multiple losses. It may not just be the surface loss. It may not just be the death of one's family member or friend, but it's all of the other losses that's a layer of that surface loss. So it could be the loss of companionship, intimacy, relationship. It can be loss of connection. So individuals will experience multiple losses. And then when we think about the grief journey, it depends on what else is going on in a person's life. So I had a person just recently lost his brother due to gun violence. And so it's other things that is also going on in, the survivor's life. How are we going to bury that person? How are we going to, get flowers, and where are we going to have the service? And then we also have to consider the fact that it's COVID and how many people, can be in the church, or how many people can be in the funeral home. So the grief journey that a person goes through, it also depends on other things that may be happening or going on in a person's life. So then we look at the definition of loss, because we talked about grief a little bit, and we also want to talk about what is this thing called loss. And so when you see the definition here, it's the absence of something. So it's really the absence of something in the future. And so say, for instance, you have a person who dies in, your family, or a client has a person that dies. It's the loss of that future. 1985, that person was in all of those pictures with us. And now it's 2021. They will no longer be in those pictures. So it's the loss of what could be or what should be. And so that's what people are grieving. It's the loss of the absence of possession of something, or that future possession of something that might have been deemed meaningful, to that person. And then when we think about loss, it's the loss of a relationship, or it's the loss of something that we were connected to. So that's the definition of loss. So then we think about the variety of losses. As I said earlier, we have death loss and we also have non-death loss. And so death loss is losing something physically. So it can be the loss of a loved one, a pet, a family member, a friend, it can be, a coworker, but it's grieving the loss of someone as a result of death. It's that physical death that is taking place. And then we have the non-death loss. So the non-death loss may be something that a person is grieving that's very significant to them. And it may not necessarily be the physical loss. It could be, but it's also the psychological loss. It's also the spiritual loss that impacts a person's life. And so when we think about non-death loss, all of us will experience some type of non-death loss. And some of us have gone through many non-death losses. So it's not necessarily grieving something as a result of a death. It's grieving those non-death losses. So it doesn't necessarily have to be someone who's died, but it's those things that is significant to that person, or something, that's close to them. So it does impact people in a variety of ways. So then think about losses that your clients may experience. Think about the losses that they may be going through at this point or may have experienced in the past. So I want you to reflect on those things. Think about losses that adolescents and young adults have experienced and may be experiencing now. And then I'm going to share some with you. So a variety of losses. So we can see here, adolescents and young adults may be grieving the loss of a girlfriend or boyfriend, and most people will say that's dumb. Why are they grieving that? But it's what's unique to them. As I said, when people are going through grief, it's unique to the person who is experiencing it. And so the loss of a girlfriend or boyfriend, you can also see the loss of a pet, the loss of a relationship or friends. Some people may be grieving the loss of their virginity. Also, you can see the loss of a child through miscarriage, stillbirth, adoption, or abortion. Also, a person may be grieving due to the fact that they have to move and they're no longer able to be with their friends because of moving and relocation. Also, the loss of identity and security, not feeling safe. And when we think about COVID-19 and we think about all of the things that have occurred in our society over the last 10, 11 months, we can also see here that there is a loss of security, not feeling safe, not feeling protected. So people could very well be grieving that. The loss of functioning may be through a disability. You also see here the loss of health due to illnesses or diseases. And people could be grieving their health because they may have an illness or they may have some type of disease. Also, the loss of childhood through abuse and neglect, the loss of parents because they're transitioning to college. Then we also have the loss of a parent through absence or being emotional, unavailable, the loss of a future. What does my future look like now? I can't go to school. I can't be around my friends. I can't participate in activities and all of the milestones that adolescents and young adults experience. I can't do that anymore. So what does that look like for me? How am I feeling about all of this? So the loss of a future, not knowing what tomorrow is going to bring. The loss of trust, again, the loss of milestones as it relates to some of the things that I mentioned. Also the loss of self-worth, the loss of self-esteem. If a person is coming here from another country, it's the loss of their native homeland. It also may be the loss of their language and their culture. Also the loss of sobriety. You can see the loss due to incarceration, immigration. Also the loss of the connection. As I said before, COVID has definitely taken us, through a lot of different things. And so we lose connections. And people say, well, we can get on Zoom, we can do Google Meet, we can do GoToWebinar, we can participate in all of these things. It's still the loss of that connection, the loss of being present physically and being able to touch, the loss of love and intimacy, the loss of faith, and the loss of hope. So these are a variety of losses. And when you look at them, and as I was talking about them, you can see here that the majority of losses are non-death losses. And that's why I was saying that most of the persons that I work with are experiencing non-death losses, more so than death losses. And I'm not minimizing death losses, but a lot of the losses that people go through are non-death losses. So when we think about ambiguous loss, and I'm going to go over this very briefly, ambiguous loss is different from ordinary loss. So it may cause, that process or that grieving process to be very complicated because, as you can see, it sometimes freezes the grief process, and it sometimes prevent people from closing it out, and it may interrupt their level of functioning. And so when we think about ambiguous loss, there are two types of ambiguous loss. There is physical absence and psychological presence. So, for example, what might be physical absence and psychological presence? So, psychological presence and physical absence could be missing bodies due to war, natural disasters that we experience, missing bodies due to natural disasters. Could be earthquakes, could be floods, it could be absent parents due to divorce, could be a person that may have had to give their child up for adoption. It also can be physical contact with parents and siblings due to immigration. So there is a physical absence. That person is not there. They're there psychologically, but they're not there physically. And so that is type 1 of ambiguous loss. And so when you look at it, there is no verification of death or no certainty that the person is going to come back the way that they were or the way that they used to be. And so then we look at type 2 of ambiguous loss. There is physical presence and psychological absence. So a family member who have Alzheimer's or dementia or degeneration of the brain, they're physically there. You can touch them, you can feel them, you can give them a kiss. Psychologically, they're absent. They may not necessarily know who you are. They may be confused about who you are. They may say, "Oh, you're my brother," but they're your child. Also, you think about people who have traumatic brain injury, also people who may be dealing with mental health disorders like depression or maybe on the spectrum. So that is type 2. Type 1 again is physical absence and psychological presence. And then type 2 is physical presence and psychological absence. And definitely it can make things very difficult and very challenging for the person who may be experiencing ambiguous loss. Then you have traumatic losses. And traumatic losses are reactions that a person have after the death, and that death was sudden or unexpected. And so I knew a person who had COVID, and the person was doing well, they was recovering, just going about their way, and then they suddenly died. And so that can be very traumatic because you were not expecting that. Also, it can be an unexpected loss due to violence or an accident. You go out one morning, or you see your parent go out, or you see your friends, or you see your loved ones go out, and they never return home. So for the person who is experiencing traumatic losses, it's sudden, it's unexpected. You never anticipated that it was going to occur. Just like with illness and disease, you never thought that it was going to happen. Then with traumatic loss, it's a sense of separation distress. Also with traumatic losses, you have emotional distress, which is the numbness, the distrust, the emptiness, the disbelief, not knowing if there's going to be a future. And then when individuals experience traumatic loss, the trauma symptoms may interfere with their ability to really navigate the typical bereavement process. And it does make it challenging as well for people to take this journey. Then you have stigmatized losses. And so stigmatized losses is one of my favorites because it's this expectation, that a person's supposed to act and behave in a certain way. And then when we think about stigmatized losses, it's those losses that do not, quote unquote, meet socially approved categories. So if a person says, my mom died from dementia or complications due to AIDS, or not complications due to AIDS, but dementia, or my mom had cancer and she was in hospice and she passed away, or my brother, had a brain aneurysm and he died. So people can handle that. But stigmatized losses are those losses that are not socially approved or in those socially approved categories. And it may result in a form of stigma to the individual and the surviving family members. And so what it is that those losses can keep people from maneuvering through the grief process and really getting the significant support that they need, because people are ashamed. People sometimes are embarrassed by those particular stigmatized losses. So think about it. Think about some examples of stigmatized losses and the reasons why those losses are stigmatized. So you can take a moment to do that, and I'm going to share a few of them with you now. I'm going to share a few of them with you now. So think about some examples of stigmatized losses. So examples of stigmatized loss could be death by AIDS, and people, or complications due to AIDS. And some people say, well, we've come far along in this process. People, don't do that anymore. Well, I do know people who are living with HIV, and some people who are diagnosed with AIDS, and some of them are still saying, it's a brief illness, it's a long illness, would never say what it is. And so it's the shame, it's the embarrassment of the particular issue or health disease or condition that the person may be going through. The loss of same-sex partners could be a stigmatized loss. Abortion, homicide, suicide, substance use related causes, mental health issues, and milestones due to COVID. So these are stigmatized losses. They do not meet the socially approved categories. And so that is the reason why they're called stigmatized losses. Okay. So then we get to anticipatory grief. And anticipatory grief is looking at what is about to happen. There is an impending loss coming around the corner. And so it definitely makes it very difficult to go through this grieving process, because of the fact people will say, well, you're about to lose your house, or your family about to lose your house, so you knew it was coming, so you should have just prepared yourself. And because of anticipatory grief, some people may find it socially unacceptable to express the deep pain and the deep grief that they're experiencing, and they may not get the support that they need. So when we think about foreclosure, or when we think about child going away to college, or military deployment, or leaving a native homeland, or leaving one's country, or terminal illnesses, or diagnosis of a particular illness, it's the impending loss. And people are grieving before the loss actually happens. It's about to come. It's getting ready to happen. It's right around the corner. And so people start to grieve before it actually happens. And so due to that, people may not share that they're experiencing anticipatory grief because of the stigma too that may be associated with, and it may not be socially acceptable. So that's anticipatory grief. And I want to go through some of these particular griefs and different losses so that you'll have an understanding of what they are. Then we have disenfranchised grief. So disenfranchised grief is a loss that cannot be openly acknowledged. It's not socially validated. No one is validating the loss, and people are not publicly mourning that particular loss. And so when we look at disenfranchised grief, it's often grief that is encountered when a loss is experienced and cannot be openly acknowledged or publicly shared. For instance, a person may be grieving their diagnosis. They may be diagnosed with cancer. They may be diagnosed with HIV. They may be diagnosed with a variety of things, and they are not able to grieve that loss. And so they're grieving their diagnosis, but somebody might say, okay, well, you'll get over it. It'll be all right. Just go to the doctor, continue to keep up with your appointments. People want to grieve that, but it's a loss that's not openly acknowledged. No one is validating it. No one is holding that space for that person to grieve that particular loss. Also, a person may be grieving the loss of their ex-lover, ex-spouses may be grieving one another, the death due to overdose or suicide or abortion, stillbirths, the loss of a pet, the loss of one's native homeland or culture, the loss of a job. All of these are losses, and disenfranchised grief may be associated with that. So definitely, I wanted to share those things with you today. Also, when we think about disenfranchised grief, individuals want to express their loss, but do not feel like they have opportunity to do that. And when they don't have an opportunity to do that, they tend to internalize it because of the social stigma, because of the shame, because of the secrecy that's associated with it, because, the loss they may feel like is insignificant. And then we think about the griever's ability to grieve. And sometimes the griever's ability to go through the grieving process may not necessarily be recognized. So a person who maybe have a mental illness or have a mental health disorder or maybe cognitively impaired, people might say, well, why are they grieving? And so it's this whole form of things of loss that needs to be validated and need to be expressed, but there is no way to do it because there is no one to hold that space for them. So again, a person may hold back on their emotions, may not share it because of the shame, the embarrassment, and the stigma that's associated with it. Then we get to uncomplicated and complicated grieving. So uncomplicated grief is often called quote unquote normal. And so the person is going through the typical process. They're going through physical, emotional, cognitively, behavioral, and spiritual responses to the loss. And what people do is call that the normal way of grieving. And so it's not complicated, it's not major things that are showing up. And when people go through uncomplicated grief, it's because they have resources, they have other mechanisms in place that's helping them as they're going through their journey. And so it is, quote unquote, the normal process of going through the pain and suffering as it relates to their loss. Then we have complicated grief. So complicated grief is grief that's continuous. It doesn't subside. Individuals get stuck in their pain. They have a lot of denial. It's a lot of distractions. People tend to isolate themselves. They avoid it. They don't want to deal with it. And then with complicated grief, there are these painful emotions that are so long lasting and severe that individuals have trouble, have some challenges in recovering from the loss and resuming their lives. So it's chronic, it's ongoing, and it heightens and it never subsides, and people get stuck in that, and it definitely debilitates them, and it also interferes with their ways of functioning. So then we have complicated loss here, and complicated loss as it relates to complicated grief is chronic, which means that it's that grief that will not subside and it continues over time. Then you have delayed. It's grief that is typically suppressed or postponed. People want to avoid the pain of the loss. I don't want to talk about it. I don't want to deal with it. Then we have exaggerated. It's grief that resorts to self-destructive behaviors like drinking, drugging, engaging in high-risk sexual behaviors. And then we have mass grief. It's that grief in which the person is not aware that the behaviors that they're exhibiting are interfering with their normal functioning. So you have chronic, you have delayed, you have exaggerated, and you have mass grief. And then you can see here some signs and symptoms of complicated grief. I'm not going to go over a lot of them, but I do want to point out a few of them. Also, people have intense sorrow and pain. They're deeply thinking about their loss and can't really figure out what's going on in their lives. And then you also have focusing on nothing else but that loss. You can't do anything else but focus on the loss. People also have bitterness about the loss. They also are numb and they detach themselves sometimes from the loss or sometimes from loved ones. Also feeling like life has no meaning or purpose. And then it's the inability to enjoy life or think back on positive experiences. It's the inability to really think about the good things. And the focus is on just what is taking place and getting stuck in the pain. Also, there are behaviors that people do to try to block out their painful reality. Sometimes people may leave a room or possessions untouched. Sometimes people spend a lot of time daydreaming about the loss. Sometimes, as I said, people avoid people, places, and things. And then there's this sense of guilt and anger that's very difficult to control. And so these are some of the signs and symptoms of complicated grief. Also, we think about complicated grief, and it continues when people begin, as I said, isolating themselves. They withdraw from activities. They're not doing some of the things that they used to do. They quote unquote get stuck, and it's really hard for them to break free. They also have health issues. Their health tends to be jeopardized. People experience depression, deep sadness, guilt, and they blame themselves for what has taken place. They believe that they may have done something wrong and they could have prevented the death. They could have prevented the loss. They feel like life is not worth living anymore. And so they wish they may have died with the person who died, or they wish their life was over because of the loss that they've experienced. And one of the things about, getting stuck, they get stuck in the traumatic part of it and they feel like they can't break free from it. So complicated grief continues when some of these things happen. So some risk factors of complicated grief. So what research says is that complicated grief often occurs more in females and with those who are older. Losing a loved one, definitely in a sudden or violent way, unexpectedly, like I said, from, murder, the death due to suicide or a car accident is an unexpected death. So that can be complicated for the person who's going through it. The death of a child. Also, social isolation or loss of support systems or friendships. As I said, we see it as people have gone through COVID, the loss of support system, not being able to touch people. Individuals who are vulnerable to mood or anxiety disorders, or people who may have PTSD or other mental health disorders. These are some of the risk factors that are associated with complicated grief. Traumatic childhood experiences such as abuse and neglect. We also see other life issues or other life stressors for, as such as difficult relationships with parents. Young adults and, adolescents may have difficult relationships with their parents. Parents may not be validating, may not be available to talk about different things. So that can cause complicated grief or be a risk factor. And then the culture in which a person lives in, or the environment in which a person lives in or are a part of, does not allow for the grief process. So what are responses to loss? So I want you to reflect, what are some responses to loss? And I'm going to go over a few things with you. Cognitive responses to loss. As you can see here, some of the confusion, feeling like I'm in a fog, I'm on autopilot, racing thoughts, just this whole preoccupation with the loss is constantly on the person's mind. Also asking, what did I do to cause this loss? Also wondering, why did it have to happen? Just people having a hard time concentrating on it. How could this have been prevented? Wondering if anything else really matters in life. So these are some of the cognitive responses to loss. Then we have the behavior responses to loss. People tend to withdraw, they isolate themselves, don't want to be bothered with anybody. They tend to fight more with family and friends. Also, you see an improvement. You may see an improvement in adolescents' grades, or you may see a drop in their grades. Also, adolescents and young adults start to act very differently. They act out, they act very reckless, they do things that they wouldn't typically do. Again, engaging in risky sexual behaviors, also using drugs and alcohol to escape the reality of it. Sometimes, they become more clingy, they hide their feelings, they're not expressing any of their feelings. They're putting it in a box on the shelf and they're hiding it away. And so these are some of the behavior responses to loss. Also, we see the emotional responses to loss. You can see some here. People are angry about it. And sometimes people think, well, I didn't know people, are angry about their loss. Yes, anger is one, frustration, disappointment, loss, loneliness. You see shock, being stunned. Also, the whole alienation from other people. Also, you see anxiety, insecurity, you also see fear, the fear of maybe I'm going to die, the fear that I'm going to lose something else, the guilt and the regret that shows up. And sometimes people have this sense of relief, okay, it's over now. I'm glad, I'm relieved. I was holding on to this. I was experiencing this anticipatory grief. I'm glad. I'm free now. It has happened. And so now I can begin to process. So relief is also part of it, and shame at being different from their peers, not, responding in the way that their friends and other loved ones may be responding. So the shame is also associated with that as well. Then we have physical responses. People tend to get dizzy. You see tiredness, headaches, stomach aches, overeating, not eating enough, oversleeping or sleeping too much, not getting enough sleep, tightness in chest where people think that they may be having a heart attack, nightmares, also shortness of breath. And some people may think that they may have COVID based on some of the responses to loss that you see here. But some of the physical responses to loss is a result of what they have experienced. And so you can see some of those here as well. Then you have spiritual losses or spiritual responses. Sometimes people have a loss of faith in God or their higher power. Sometimes they get confused about, is there a God? Why did God let this happen? Why did I have to lose my house? Why did my mom and dad have to lose their jobs? Why are we going through this? Sometimes it's just a whole questioning. People become angry with God about the loss or the death. They sometimes abandon their religious practices. If God allowed me to go through this, I'm not going to worship service anymore. I'm not going to the synagogue. I'm not going to church. I'm not going, to the mosque, because this has happened in my life. And then people have a lack of hope and an inability to forgive. So these are some of the spiritual responses to loss. And so I wanted to mention what Kai Gibber says. She says that let grief find the freedom to be expressed, let grief find the right to be understood. And so we see here some of the responses that people make when people are going through or experiencing grief and loss. People say a lot of different things, and it doesn't help with the process. It doesn't help with the journey. And so people say a variety of things. So I'll just share a few things with you. You must move on. You got to move on. Why are you sitting here? You know, I know how you feel. That is the major one. I know how you feel. I understand how you feel. No, you don't, because as I said in the beginning, a person's grief journey is unique to them. So how can you understand and know how I'm feeling? And so when it comes to adolescents and young adults, we might say, I know what you're going through. I know what you feel. And we really don't. So these are some of the things that people say when others are grieving. Also, when we think about what adolescents may be going through right now, somebody might say, you know what, it's just school. I don't even know why you're even grieving that. Just get over it. Just call your friends another way. You don't have to go to their house. It can't be that bad. I mean, you're making a lot out of it. It's not that bad. You'll get over it in time. Be strong. Snap out of it. You just got to be strong for your family. You've gotten through other things. I know you can get through this. And some people might say, you still talking about that? So again, these are common things or common responses that people say when others are grieving. Okay. So what can we say? We can say, I'm sorry for your loss, and just leave it at that. It's not a paragraph. It's not a book. It's not a novel. Just leave. I'm sorry for your loss. And you can say, I can't imagine what you're going through. I do care. I don't know why, because you know, a young adult or adolescent, I don't know why this had to happen. Why are we going through this? Why is COVID showing up now? This is my last year in high school. Why do I have to be going through this? And so instead of trying to explain it, I don't know why, but I'll be here to listen. I'll be here to sit with you. I don't know what to say, but I'll be glad to listen. Again, what can I do to help? These are some of the things that we can say to persons who are experiencing loss. We can be silent. We can just sit back and just allow them to share, you know, what it is, you know, they need to share. Sometimes we think you're young, you'll bounce back from this, you'll get over this, and not holding that space and not allowing that person to validate how they might be feeling. Sometimes a person might say it was just a dog, it was just a cat. You can get another dog and a cat. It was just a house. Your parents can buy another house, you know, and we don't validate what a person may be going through. And so these are some of the things that we should be saying. Then we have these two difficult emotions. The most common ones is guilt and regret. The guilt is because the person really did something wrong, and because they feel like they did something wrong. And then it's the whole feeling of the guilt. And so there is work that need to be done around the guilt, around taking responsibility, forgiving oneself. You know, it's the guilt, trying to make reparations if possible, seeking forgiveness from others. So it's the perception that I did do something wrong, or it's feeling like I did something wrong. So people kind of take on the guilt. Then it's the regret. When people find that the emotion is regret, they may find that working through it involves things like acceptance and really determining how they're going to grow, how they're going to develop, and how they're going to learn from the experience. I regret the fact that, you know, I didn't sit with my grandmother. I regret the fact that I didn't say, you know, something nice to my teacher or my professor or whatever. And so it's this whole regret that you are experiencing. And guilt and regret are definitely two of the most difficult emotions that people experience. So then, some thoughts about how we can help if grief is so stigmatized. Some of the things that we say, time heals all wounds. No, it doesn't. It just allows the person to be where they're at. Sometimes people say grieve alone. People need to be supported by others in their lives. They might say be strong. You need to take care of things. You need to be the man of the house. Those are things that, you know, we should not be saying. Sometimes people say keep busy, you know, continue to do your work, continue to press forward, just keep busy, you'll be all right, you'll get through this. Grief having an end point, there is no end point, there is no timeline. And then if a person is not crying or expressing it in an outward appearance or in an outward way, then people think that they're not grieving. So what do we want to do? No more stigma. We want to normalize grief and loss. We want to make it normal. It's part of a normal conversation, but we put grief and loss on the island by itself. We making sure that we're not judging, making sure that we're not judging what a person is going through, discussing the grief and loss. If a person or adolescent or if a young adult want to talk about it, don't change the subject. Validate the feelings. Let grief be what it is. It's not pathological. It's not a mental illness. Don't rush through it. Don't try to avoid it. Don't assume that young adults and adolescents know how to feel, but don't assume that they should think and feel in a certain way. And it is a common experience. Grief is a common experience. So some principles. Grieving is an adolescent's natural reaction to loss and death. It's all part of what they're experiencing. It's going to be very unique to them. It's what they're experiencing. It's what they're feeling. There is no right or wrong way to do it. Every death and loss is unique, and the person is going to go through it very differently. And then the grieving process is influenced by many other issues, as I said, that may be going on in that person's life. So here are some things I just want you to look at. I'm not going to go through them, but I will share a couple of ones with you. Also, when you think about adolescents and young adults and they're not coping, you might see changes in their relationship and family roles. You also may see changes in their sleep patterns and their appetites. They may have some concern about being treated differently. You also see here abandonment, maybe some rejection, and they may have some anxiety about their future and how that's going to look. Then you have other risk factors as well. This hopelessness. You also have a lot of risk taking, behaving dangerously, breaking the law, drugs and alcohol use. Again, extended withdrawal and isolation from family and friends. Maybe ongoing suicidal thoughts or self-harm may be some of those. Some other risk factors could be low self-esteem, maybe parent-child conflict, maybe family conflict, all of the things that may be going on in the home, parent drug use, lack of parental attachment, abuse and neglect may be going on, lack of adult supervision, poor attachment, peer and parent rejection, poverty, home, school, and community violence. So these are some of the things that might be going on. So what are some tips for adolescents? Some tips for adolescents is just allowing them to grieve and allowing them to be okay with the grief, making sure that we're not criticizing them, helping them to feel okay and be open to talk about their grief, not judging how they may be feeling. So some of these things are very important as we're working with adolescents. And then we think about young adults. They have a huge range of emotions. And so they can go from fear to anger, to relief, to anxiety, to numbness, irritation. They can go to resentment. So it's going to be a wide range of emotions. Also, grief turns out to be so much more than emotion. It affects the body, it affects the soul, it affects the spirit, it affects the brain, it affects all of those. And it's like a roller coaster ride. And it sometimes shows up in being, as far as being exhausting. I'm going through this, and so it's more than just the emotions. It's how it affects a person globally or comprehensively. It's sometimes hard for young adults to do the things that they used to do. Grief takes a lot out of a person, so it takes a lot out of their mental, emotion, and physical bodies. And so, doing daily things, exercising, doing the things that they need to do to increase their energy level. Also, there is no manual. There is no timeline on how a person's supposed to grieve. It is what it is. People might say, you still going through that? You still talking about that? It's been like 5 years and you're still going through that. So these are some of the things that we want to consider as we're working with adults. All right, so as we're looking at the SBIRT model, some of the things to help people, and we're going to go into that now. Listen and talk with them. Be a listening ear. Don't interrupt, don't judge. Provide that safety net. Provide that safety and security for them. Letting them know that it's okay. You can go through this process with me. I'm not here to judge or ridicule or criticize you. This is a safe space. Provide opportunities, for them to grieve, whether it's writing, taking pictures, talking, Joining a support group provide those opportunities for expressions and allow for a range of responses to grief. It might be 1 minute I feel happy or joyous, and the next minute I might be sad, or I might be feeling lost and confused. So allow for ranges of responses. So now we get into SBIRT and how to open this up in SBIRT model. So using SBIRT in grief and loss conversations. So screening assesses for the presence of symptoms of complicated grief, and it identifies the appropriate level of services and treatment for the individual. Also, when we look at brief intervention, it focuses on increasing insight and awareness regarding depression and complicated grief and motivation toward behavior change for coping with loss. And then we look at referral to treatment. It provides those identified as needing more intensive services and treatment with access to appropriate services for grief and loss, which may include counseling, therapy, coaching, support group, and other services as needed by the client. So what are the benefits of SBIRT? So the benefits of SBIRT as it relates to grief and loss is preventing self-destructive behaviors and unhealthy coping mechanisms. It's also helping those with complicated grief symptoms become educated and get the treatment that they need. And it also enables the clinician to screen and assist clients who may not be seeking help, to help motivate them and encourage them to understand, recognize the stress and the risk factors of loss, and also actively capitalize on their strengths and protective factors. So as you can see here, there are a variety of settings to have these grief and loss conversations. I'm not going to go over them, but you can see a variety of settings where you can do SBIRT and incorporate those grief and loss conversations. Also, benefits of some of these various settings is that you want to screen individual for uncomplicated and complicated grief, as I talked about previously. You also want to provide interventions for grief and loss and self-destructive behaviors. It's an opportunity to provide education, the person who's sitting before you, or provide some type of early intervention. Also allow for simple triaging, really begin to triage and, so that you can see where the client needs to go and what they need to do. It also helps client recognize signs and symptoms for complicated grief, especially clients who do not have access to services or who may not seek therapeutic services and treatment. And then brief interventions, providing those options and those referrals. So brief intervention in opportunist settings. Brief interventions are advantageous because people are usually open and accepting of this type of intervention. So it also provides that safety net, definitely security, so the person can really begin to talk. It allows for teachable moments. It's useful in motivating clients, to help them seek out additional help for some of those more severe issues, especially complicated grief. As you know, it's less expensive and can be administered in a variety of clinical settings. So what do we want to do when we're having these grief and loss conversations? We want to listen with empathy, stop what you are doing, look at the teen or the adolescent or the young adult, listen, find a way to understand what they might be feeling or saying. You may not always agree, but really just kind of stop and listen to what they're expressing. Also provide regular opportunities for them to talk, to check in with them. Also don't interrupt. Let the adolescent and young adult control the conversation. And so we'll talk a little bit more about that. Keep it open. Again, keep it open. I see. Tell me more. Tell me what you think about that. Acknowledge the feelings that you're hearing. You can say, I can see that really upsets you. You're really hurting right now. Talk with them about more things than just the loss. Listen for some other things that might be important to them. Also, again, acknowledge what you're hearing. Allow them to take control over the conversation. So those are some of the things. So when conducting a grief and loss screening, you definitely want to ensure confidentiality. What we say in here stays in here unless somebody says that they're going to take their life or harm someone else. We definitely want to ensure that this is a safe space and we're going to hold that space for them, but make sure they understand that. Ask direct questions about specific responses to the loss. What does that mean? Tell me more. Please clarify that for me. Normalize the question. That's not weird to say that. You're not going crazy. It is what you're experiencing right now. Be non-judgmental. I hear you. I'm here. I will listen. Also start with less threatening questions. How have you been coping? How have things been for you lately? Don't assume anything. I guess you haven't done anything, or I guess you are not doing well. That's an assumption. Ask for explanations of coping mechanism. What does that look like? What does that feel like? How have that helped you? And use specific terms like death, dying, grief, loss, bereavement, mourning. Use specific terms. Okay. What can you do in a screening? What can you do if you have one question, or if you have time to just ask one question? What loss or losses have been most impactful for you? If you have two questions to ask, you can see here. What have been anxious? Have you been anxious and depressed this week, last week, the past month, maybe the past 6 months or the past year? And if yes, how many times? And then you might want to ask some other questions. What were your loss? What have been some past losses? How have you coped? What else would you like to share? So these are just as a quick way to really be screening the clients and how to incorporate this into the expert model, because if you don't have time, this is a quick way to do it. Now you screen for grief and loss using the brief grief questionnaire. So Dr. Shear and Susan Exock developed this screening tool, and it really helps to screen persons for complicated grief, and it's 5 questions. And so as you can see here, for adults who are bereaved for the last 12 months, and then younger persons or children for the last 6 months. And so basically what you're doing is screening them for suicide risk, mood, and anxiety disorders as well. So it's 5 questions, very simple. These are the 5 questions you see here. How much of your time are you having trouble accepting the death of a loved one? Or you can say, how much of the time are you having trouble accepting the loss? How much does your grief interfere with your life? How much are you having images or thoughts of your loved one, or images and thoughts of the loss? Are there things that you need to do that you used to do with your loved one that was alive that you don't feel comfortable doing now? What are some things that you are avoiding? And how much are you feeling cut off or distant from other individuals since the loss, or since the loved one died, even individual you used to be close to, like family and friends? And so you can see how to score it. Again, it's a 5-item screening tool, which can be used to identify clients and individuals who have a high risk of complicated grief. And if they score 5 or greater, then you certainly need to refer them to a mental health professional. All right. So now you can see the brief grief questionnaire here, and there will be some handouts. There will be some resources for you to use. But this is a picture of it, and this is how it looks. 5 questions. So I kind of incorporated the CAGE model or the CAGE screening tool, and I incorporated it to grief and loss. So CAGE stands for cut off or cut. Have you ever cut people off while grieving your loss? So I incorporated it to grief. The A stands for have people annoyed or criticized you for grieving your loss? The G stands for have you ever felt bad or guilty about grieving your loss? And the E stands for have you ever needed substances or engaged in risky behaviors as an eye opener to steady your nerves, to alleviate anxiety or depression, or to get rid of feelings associated with your loss? So instead of using CAGE for alcohol or CAGE A for drug use, I incorporated it into the grief and loss conversation. So you can see here that you can use CAGE to help you screen for some losses in that person's life. All right. So then I took CAGE and I used the scoring tool for CAGE, or I used the scoring grid for CAGE. So items, responses on CAGE questions are scored 0 for no and 1 for yes answers, with a higher score being an indication of complicated grief. A total score of 2 or greater is considered clinically significant and definitely needing to refer that client to a licensed therapist. And so I kind of put a note in there based on the information that I received about CAGE. The normal cutoff for CAGE is 2 positive answers. However, based on the consensus panel, they recommend that the primary care clinicians lower the threshold to 1 positive answer to cast a wider net, and then it helps you to identify more clients or patients who may have complicated grief. Okay. So here are some further assessments you can use. You can go here. Some of these will be in your toolbox or your handouts and resources that will be provided on the website. But here's some links that you might want to consider as well to do further assessments. So what is important about the brief interventions? You definitely want to meet the client where they're at. That is most important. Wherever they're at, that's where we want to start. Also, when we think about brief intervention, it does save time. It saves times because we're helping them to begin to identify some of the things that they want to do, some of the things that they may need to do to help them. And it also dedicate limited financial resources so you can do it in a setting, and it's kind of like a catch-all. So you can do all of this in one setting, and it is a catch-all. So one of the things that we know, some of the brief interventions or some of the elements is the sessions last about 10 to 15 minutes. And you can see here, there are 4 elements: establishing rapport, establishing that relationship with the client or the patient, raising the topic and express concern about grief, loss, coping, risk factors, and self-destructive behaviors. You also want to provide feedback, unhealthy ways that the person may be coping with loss and other factors that may be interfering with healthy grieving, and then enhancing motivation to increase those protective factors and discuss a plan of action when appropriate. Also, conducting a brief intervention. So one of the things that you want to do is understand the client's views of loss and what they feel about the loss in their life. So you might want to say, how are you feeling about it? What have you felt in the past? What are you feeling now? You definitely want to give information and some feedback. So you might say grief is, or how did you define grief? Some things you might be experiencing, dot, dot, dot. What do you think? This is what I hear you saying. Let me make sure I have this correct. So again, you want to give information. You also want to give some feedback. Negotiate a plan with them. What do you think are some healthy ways to cope? What might be some unhealthy ways to cope? And then you want to close out. So I like to close out with, what is one takeaway message? One thing that you would like to share, or one thing that you would like to say before we close. Okay, so then we look at the brief negotiated interview. So we think about the engagement. So you might say, I'm glad you came in today. Thanks for seeing me. And before we start, I would like to know more about you. What would you like to share about yourself? When coping, how has alcohol and drugs fit in to your coping mechanisms? You also might want to say, I would love to review and dialogue about some risk factors that may be increasing your use, some risk factors that might be interfering with your grieving, that could also be affecting you and how you're handling your loss. So this is the way to engage your client. This is the way to engage your patient. Also, you want to think about some of the pros and cons. So you might want to say, I'd like to understand more about your loss. How might risk factors be interfering with your loss and ability to grieve? What are some things you've used to cope? Some good and not so good things about them. You stated that you were quote unquote good. Tell me more about that. This is what I hear you say about the loss. So then the pros and cons could also be, on one hand, you say you're good or you're well. And then on the other hand, you say you're not sure about what you're feeling. So again, you're helping them to look at some of the pros and cons, but also you want to be able to address some of the discrepancies of how they may be experiencing what they're going through. Also, the feedback helps to make the connection. And so some of the things that you might want to say with the feedback is, from what I see or understand, you are experiencing complicated grief. What do you think about the risk factors and how they might be interfering again with your grieving? So you might want to also do some reflective listening, stating what the client has said or the patient has said. Your understanding is that your lack of connection and your parents are not validating your loss has an effect on you. What do you know about risk factors and grief that are causing you to increase your use? So you also may want to associate it with their use or potential use. What do we know about risk factors is that they could hinder your grieving journey. And then you want to ask them, what do you think about all of this information? So again, it's the feedback. You're reviewing the screening questions, and you're also having a dialogue because you also want to make that connection. So another thing is the readiness ruler, or the readiness. I use readiness and confidence scale. So the readiness scale, on a scale of 0 to 10, how ready are you to change your life or move towards your goal, or to move towards this grieving journey, or move towards your protective factors, or move towards the future? A 10 would mean you are fully ready to change, and a 0 means you're not quite ready. And if clients score a lower number, then you ask, what would need to happen for you to rise to a higher number? Then the confidence scale, on a scale of 0 to 10, how confident do you feel to make changes in your life after your loss? Again, a 10 would mean total confidence, and a 0 means no confidence at all. If a client scores a low number on the confidence scale, then you might want to ask, what needs to happen for you to feel confident? What have you successfully changed in the past? What can you use to gain that confidence? And then allow the client and the patient to discuss that. Also, you want to negotiate a plan or have some type of action plan. So you might say, what are you willing to do for now as it pertains to grieving and feeling safe? What do you want your life to look like now down the road? How does this all fit with where you're going, or where you want to go, or where you see yourself as you're taking this journey? What are some challenges to reaching that? Because you definitely want to explore what some of those challenges might be. What have you planned or done in the past that you may feel proud of, or have felt proud of? Who or what has helped you succeed? Who or what has been here for you? Definitely really asking about, how are you grieving now? What are some of the challenges of grieving now? What are some challenges of embracing the loss? And if you wanted to make changes, how would things be better? So again, you want to negotiate an action plan, and you want to be able to ask some of those questions. And you definitely want to envision, or help the client envision, the future. You also want to begin to explore some of the challenges. Also, you want to draw on the client's past successes or their past strengths. And then you also want to ask them, or really want to negotiate, what are some benefits of going through this journey? And then you want to summarize and thank them. Let me summarize what we've been discussing, and let me know if there's anything you want to add, anything that you want to share, or anything that you might want to change. Which of these services that I've mentioned to you, if any, are you interested in? And then you might want to say, here's the action plan that we discussed. Is this something that's helpful for you? Is this something you think you can do? What do you plan to do, or what are some of your next steps? And then you also want to say, thank you for sharing with me. I like to say thank you for allowing me to be a part of your world, or thank you for showing up and, allowing me to share this moment with you. So again, you want to reinforce resilience and resources, maybe provide some type of handouts, really talk about an action plan, and what's the next steps, what are they planning to do. And then you also want to thank them as well. I always thank a person for coming, because they don't have to come. All right, so we're going to skip this because we talked about the readiness and the confidence scale. So motivational interviewing is another tool that you can use as you're talking to clients about grief and loss. Motivational really helps to explore the ambivalence about the grief and loss, to really clarify the reasons for taking this journey and for moving forward. So you definitely want to start with the OARS acronym, open questions. So it definitely opens the door for the client to talk. So some examples might be, how do you feel about that? Tell me the last time you cried. What do you think are some good things about this journey? What do you think might not be some good things about this journey, or not so good about the loss? Also, you want to do some affirmations. Affirmations are statements of appreciation, and helping, helping the client understand that they're in a supportive environment and supportive atmosphere. And it also helps build that relationship with them. It affirms that they have strengths, the strengths that they bring to the table, and it helps them build their confidence. So some examples of affirmation might be, you're doing a good job. I appreciate that you're willing to talk with me about your loss. I appreciate the fact that you're willing to share this with me. So reflective listening is reflections, or reflective listening are statements to reflect back the feelings and meanings that the client have expressed, as well as the words that they may have used. So examples could be, it sounds like you're concerned about your loss. It seems like you're surprised that you cried. it seems like you're feeling uncomfortable about talking about your loss with your family, and then you summarize. And definitely summarizing is a great way to gather what has been said by the client and really help preparing them to move forward. First, the clients hear themselves say it. Then, as a clinician, you kind of reflect back what they've said, and then it's heard again in the summary. And then you may want to decide some things to say and some things not to say in the summary. And then, with that as well, you can also close out by thanking the client for coming and participating. Then elicit, provide, and elicit. I really like this part of it because in motivational interviewing, you can elicit, provide, and elicit. So you elicit what the client knows. So you might say, tell me what you know about grief and loss, or how people grieve, or what you think about grief counseling or grief therapy. Then you provide new information to kind of fill in the blanks for what they didn't say. Something you might not know about grief counseling is ... Something you may not know is that everyone grieves differently. Something you may not know is that ... So again, it's filling in those blanks. And also elicit what the client's response might be to the new information that's been provided. What do you think about what I've just told you? What do you think about what I've just said? How are you feeling now about all of this information? And what would you like to say? So again, you can do elicit, provide, and elicit. All righty. So the next thing is name. So one of the things I like to think about is some brief intervention questions. So these are some questions that you might want to think about. And I try to make it very concrete. So you might say, name some individuals. Well, they might name 20 individuals. So I try to make it very concrete. Name 3 individuals who have supported you thus far. When you hear the expression, accept your loss, what comes to mind? How possible is it for you to accept the loss? What makes it difficult for you to accept it? What loss in your life have been challenging to accept? Who can or what can you start doing now to accept the loss? Other people who can be with you on this journey. How will you continue to utilize your supports, as you're going through this process? What protective factors do you have to help you with your loss? What have you tried? What has been helpful? What haven't been helpful? You seem to be resilient. What do you think helps you bounce back? How have people around you helped you overcome this challenge? What are 3 things that have helped you overcome some of the obstacles and challenges as it relates to your grief and loss? What's important in your life right now? So again, these are some of the questions that you might want to ask them. What kind of supports, again, have been most helpful for you? How did they help you as you've gone through this journey? What resources do you need now? What other things might be helpful for you as you're taking this journey? Okay. So brief intervention may also be capitalizing on a strength-based approach. I really love a strength-based approach because I really love capitalizing on a person's strength. Everybody brings strength to the table. So I really love, capitalizing on that. So you can see that when we use a strength-based approach, we're working to find past and present successes, and we use them to help address some of the challenges that the client may be facing. So they do bring that to the table. So how can we use that now? Also, it helps clinicians, as far as helping their clients look at strengths versus their weaknesses. Also, it may help clinicians because they're helping their clients look more at building the best things in their life instead of always repairing the worst. Not always looking at the worst, but building on the best things or building on the things that they already have. And then helping clients make their lives meaningful instead of looking at grief as pathological or looking at it just some great mental illness, but really looking at ways to help clients fulfill their lives in a more meaningful way. So I really like capitalizing on the strengths of a client. And this is something that you might want to consider in a brief intervention. Also, you might want to think about protective factors. What are some of those protective factors? Social support. And so when you think about some protective factors, you want to look at social support. You also want to look at coping skills. You also want to look at physical health, sense of purpose, self-esteem, healthy thinking, mental health, and spirituality and beliefs. And there's a handout that I do have that will be on the website. But when you look at some of these protective factors, you're going to rank them with the client based on weak, moderate, and strong. So for example, social support. Do they have ability to talk about their problems? Coping skills. Are they aware of their own emotions? Physical health. Do they have a balanced or healthy diet? Sense of purpose. Do they understand their personal values? And are they living in accordance with those values? Self-esteem. Do they believe that they have value? Do they believe that they have worth? Healthy thinking. Do they have the ability to consider personal strengths and weaknesses rationally? And then you're going to rank it based on weak, moderate, and strong. So like I said, there is a handout for you. Another thing that you can use with brief intervention is using frames. Frames is another way. It's a brief intervention, and so definitely you can look at giving feedback. Compare the client's grief with ways they've been coping with the loss. The client may not always understand about the risk factors and how it may be fostering the grief. Also check the client's understanding of maybe engaging in high risk behaviors or using unhealthy coping mechanisms. That can be a concern. And then you may want to ask the clients feedback or seek their reaction based on what feedback you're giving them. Also, responsibility. One of the things about responsibility is emphasizing that it is the client's responsibility for making their own decisions about grief and moving forward. Advice, looking at ways to change behaviors or those risk factors and how they're coping with the loss. Also giving a menu of strategies, giving options. I always like to look at it as a buffet. We spread the buffet and then they get to choose what will work for them. It may also involve, drugs and alcohol or some other risk factors, or offer options for coping. So give them menus of options to choose from, and that's going to foster their involvement in the decision-making process. Using empathy, being empathetic, being respectful, not being judgmental. And self-efficacy is definitely expressing optimism, expressing that hope that the individual can really modify and can really change how they feel about the loss and how they're going to move forward and how they're going to take the next step. So definitely this is a way to use frames. Then you also have flow. So flow is feedback, it's also listening, and it's also, again, options. So one of the things about flow is that, it's the 3-step and it's very simple to use. You begin the conversation with feedback, which involves the client about their screening results and explaining what they mean. So your score was ... and this places you in the category for complicated grief. So you definitely want to explain what complicated grief is and also possibly give some signs and symptoms for it. Also listening and listening, what they're feeling. You might ask the client, what do you think about that? How are you feeling about that? Also begin to explore some pros and cons of moving forward with counseling and therapy. Ask about importance, again, on a scale of 1 to 10. How important is it for you to get counseling? How is it important for you to get counseling for your loss? What was your reason for giving that number? And why wasn't it lower? And what would you need to rise that number? Also ask about confidence. How confident are you that you can get through this grief journey, to go through this process? How confident are you that you can process your grief? And again, if it was a certain number, what was your reason for not giving it a lower number? And what do we need to do to raise that number to something higher? So definitely feedback, listening. Also listening is, working with the client to really begin to explore the meaning of complicated grief. Again, as I said, looking at the risk factors, really looking at some unhealthy coping mechanisms and the important concerns that the client may be bringing to that visit. And then during this step, we might also want to assess the specific kinds of changes the client may be willing to make and their readiness to go forward with this journey. And then the last thing are the options. Let me go back. The options is explored where there is the discussion of menu of options. And these can be identified by the client to support positive coping skills, changes, to really explore protective factors and supports that might be useful or helpful for them. You might say, what do you think will be helpful? Who can you ask? What have you used that have worked in the past and what can you use now? And so again, you ask key questions about what they want to do, how they want to change, what is the next step for them. And so, when it comes to grief counseling, how would they do that? If they wanted to go to counseling, who would help them? So it's asking them those questions as it relates to the next step. Who will be there with them? Who will hold the space for them? How might they get there? What might they do? So these are some of the things, or what are some of the protective factors? Who might support them in this process? So those are some of the things. And then again, it goes back to, some of the options. So all of these things are helpful ways, to do the brief screening by giving feedback, by listening, and also providing those options. And so the last thing I wanted to share with you is a grow coaching model. So the grow coaching model is definitely a model that talks about where the client wants to be, what's happening now, the options is what they could do and what they want to do. And so the grow model was really came out of coaching, and it was developed in the 1980s by Sir John Whitmore and his colleagues. And so it's goal, reality, options, and way forward. And so this model helps the client get to a higher level, set goals that might seem to be challenging, and it really helps the clinician help the client, with the ownership on them. And it's a process of asking some powerful questions that open the client up, to their own potential, to their own strengths, to their own successes. And so this is a model that, I've used, and the grow model really gets to what is it that the client really wants. And it allows clients to explore their motivational connection to their next steps or to where they want to go. It also allows for exploration of their strengths and how it's going to support them as they're moving forward. The option is, supported by just kind of brainstorming various strategies to meet the needs of those next steps. The way forward is really looking at when are you going to do it? Where are you going to do it? How are you going to do it? So it's really the way forward. And then during this process, it's giving the client the willingness to do it. And so for the goal, you might say, what would you like to focus on today? Due to the loss, where do you see your life being out of balance? What are some challenges you're facing right now? What should you be working on, or what should we be working on or working toward? What is your next step? For the R, which is reality, what is working well now? What does guilt and regret look like to you? What have you done so far to help with your loss? What does self-sabotage look for you? What is your inner critic saying to you about your loss? What are some fears that are present now? So options, or sometimes they talk about options or obstacles. What is your first step? What are some things you can do? Whatever your first step is, can you think of anything that might stop you from doing it? What might get in your way? If someone else came to you with your challenge, what would you tell them? Or if someone came to you with a loss, what would you tell them? What strengths can you use to help you? And that's the options or the obstacles. And way forward could be on a scale of 1 to 10. How motivated are you to move forward? What will it take to get you to be motivated or to get you closer to that 10? What are you willing to do in the next 24 hours? What will you do when you've achieved that? And what do you need to include in your journey? And what else do you need to consider before we get started? And when are you planning to do it? So you can see way forward is what, when, by whom, and the will to do it. So that is using the GROW model, which is a coaching model, which is very different than what we may use, but it's also an opportunity to use that. And so here is just the little picture that I wanted to leave for you. I'm not going to go over that, but it's something that you can use and you can tweak it to what you need to tweak it for. And so referral to treatment. So having a list of resources are essential, and linking people up. I don't always like to say referrals. I like to say linkages to services and treatment. And also knowing the different types of treatment and methods of care is very important. Knowing the difference between counseling, coaching, and therapy, because there is a difference. And then one of the things that I put on here, just one locator resource, is Psychology Today. And if you're looking for clinicians or therapists or practitioners, you can go on Psychology Today, type in grief, and a lot of professionals or practitioners will come up, ones that specifically do work in the grief field. So I'm not going to go over key points. I'm going to finalize it. So really helping a grieving adolescent and young adult is definitely understanding their loss, Also understanding how they're showing up, really opening up an opportunity for them to share, because maybe the parents don't talk to them, or maybe they feel like they can't talk to other people, but really providing that space, helping them to discover some significance or reason behind their loss. And not that we're going to have all of the answers, but really letting them talk through it. And don't assume that an adolescent and young adult aren't grieving if they're not showing emotions. Provide key points when providing support: being gentle, providing that consistent support, being available. Don't push them to talk. Help them find peers or other people who may be supportive. Help them find other trusted adults in their life, maybe a therapist, a counselor, or a spiritual leader or mentor. Work on helping them reduce some of their reckless behaviors or some of those risky behaviors. Discuss their feelings of hopelessness. Definitely normalize the feelings of nothing matters, that life isn't fair, and also really avoiding cliches when we talk about loss and when we talk about death. Key practices in the field: help the client or patient acknowledge that they've done past things, they've had past accomplishments or past successes, and helping them to reestablish this will also boost their self-esteem. Affirm and give them hope that they're able to survive their loss. Ask them about other things that they can use to help them as they're going through their loss. Give them permission to cry, permission to feel, permission to be where they're at. When we talk about grief and loss, sometimes, people shut it down, but we want to give them an opportunity to process it, identify it, and also express it in only the way that they know how to express it. Also acknowledge for them that there are going to be some setbacks and remind them of that. Also, with grief, it can be emotionally and physically exhausting. Encourage them to do things to take care of their bodies: exercising, eating right, getting proper rest, doing things that's going to help them as they're going through this journey. Encourage self-patience and patience with others who might be trying to help them or trying to help them understand what they may be going through. Remind them to have realistic goals and expectations about the amount of time required to heal from their grief. Because people say, well, it should only take you 3 months, 2 years, but allow them to know that there is no timeline or no time limit on the grieving process. Encourage them to take one moment at a time, take it slow, be gentle with themselves, reassure them that it's okay to set limits with other people. It's okay to say no. Encourage them to do small things as they're going through their pain. Affirm of the right to feel good, to have joy, to have hope, to even establish new relationships as they're going through this process. And so the last couple things is, this is what I need you to know. So an adolescent and an adult is saying to the adults in their life, this is what I need you to know. Don't force me to talk. There may be times that I'd rather be quiet. Check in with me sometimes. Instead of saying, I know how you feel, ask what it's like for you, or what are you feeling? Listen to me and what my grief is like. Remember that I'm still young, or I'm a young adult. I still may want to have fun. I still want to do some of the things that I've done before. So don't expect me to take on this quote unquote adult role or this parent role. Don't tell me to be strong. I'm learning that it's okay to feel and show vulnerability, or to show vulnerable emotions. And it also reminds me of that, and that I can do that. Give me some space to grieve. Don't over obsess about what I'm doing or how I'm doing, or don't hover over me, but give me that safe space to be able to go through this process. So these are some Teens Bill of Rights by the Dungy Center. And so I'm not going to go over them. There is a handout that's going to be posted on the website that says Teens Bill of Rights. And so I'm going to end with one thing, and it's called Okay. And it's a little poem that I want to end for us today. And it's by B. Mitchell. And it says, okay, do you have some time? I need to talk. I need someone to listen to me, okay? Wait a minute. I didn't ask you for advice. Please, I only asked if you would listen to me. I didn't ask you to explain or modify my feelings. I didn't ask you to direct or correct my feelings. If I'm told I shouldn't have my feelings just as I do, it hurts me. They're mine and nobody else's, my feelings. When I need you to listen to me, I'm not asking you to fix my problem, only to listen to me, okay? Yes, I pray and I speak to God. I also need the caring, the warmth, the energy of another human being. God is not enough. I need other people. At times, I need someone just to listen, to be a soundboard. Then I hear myself think. I start understanding myself better. It's amazing. If you need me to listen to you, I'll be happy to do that, but each of us in our own time. Okay? And so the last thing by Dr. Wolfelt, he says, grief is a normal and necessary process that is fundamentally a journey of the heart and soul. So I'm now going to turn it back over to Tracy, and here are some resources that you will have, and that's it. Thank you so much for sharing your time with me today.
Well, Lisa, thank you for sharing your time and your expertise. I know I've learned a tremendous amount. I know others are too. Just incredibly rich, very informative. Helps us think about things we haven't thought about in the context of screening, brief intervention, or referral to treatment for adolescents and young adults. It's not a conversation we often have, or their trainings don't often incorporate the types of conversations and appreciation of grief and loss of young people the way you have shared with us. And I think it really helps us to think about, when we're utilizing SBIRT and we're focusing on conversations about a range of substances, we expand our thinking to think about a range of emotional and mental health concerns. You tapped a little bit on a variety of those in terms of depression and anxiety, risk of suicide, and how they all connect. And so you can have a fuller, more robust conversation and not sort of address one thing as if it exists in a vacuum. And this gives us some guidance on how to connect these really important pieces. So thank you so much. In our last few moments together, just as a reminder, our team will send you a follow-up email later today that includes a link to the PowerPoint slides, the on-demand recording, the brief survey, and instructions to claim your free CE certificate. And if you want to access any of these things right now before the email arrives, you can do so at the website dedicated to this webinar, sbirt.webs.com/grief-and-loss. To augment the information provided today, you can check out these additional resources from the ATTC network. As you can see, there are many interesting topics represented among these resources, including recorded webinars and handouts on topics such as marijuana use, recovery, and vaping, among others. You can also keep in touch with the ATTC via their newsletter and on social media. You can sign up now for the Messenger, monthly email, and follow them on Twitter and Facebook. The PTTC network also has numerous resources available to support your work with adolescents and young adults, including those on youth opioid use and vaping and evidence-based practices to address substance use. And the PTTC offers a monthly newsletter called The Post, and there are numerous ways to also connect with them via Twitter and Facebook. And so we hope you will stay connected. So with that, I just want to thank again, Lisa, for being with us today and sharing your expertise, as well as to everyone who attended today. And we look forward to having you with us on future events. I hope everyone has a good rest of the day.